Hi, and welcome to Fresh Waves. I'm your host, Bren Masson. Today we're going to be continuing our organ donation awareness shows, and if this is the first time you're tuning in, I'll let you know that every April we do a number of organ donation awareness shows for Organ Donation Awareness Month. And if you haven't done so already, please go to beadonor.ca and register to be an organ donor and let your family and friends know your wishes. In a time of great stress, towards the end of your life, you don't want to have to be explaining or hoping that someone else will explain for you. You want everybody to know that you are an organ donor and you want to register, so that the medical team knows that, in fact, you are an organ donor. Today, we're going to be speaking with Sandra Holdsworth. Sandra has been a part of this series of shows for the last 10 years. She is a liver recipient, and she's now looking for another liver, and this time a liver and a kidney. Sandra, welcome to Fresh Waves. Nice to have you back.
Hi, Brenda. Nice to hear you. Thanks for the introduction. Thanks for having me back. I appreciate it.
Well, you are back on the hunt for a liver and a kidney. And how's that going?
Yes. It's getting difficult now, to be honest with you. So I'm fortunate to have had my first liver transplant in 1997. So it's 29 years of extra life that I wouldn't have had without my donor. But I do find myself back on the list. It's just a reminder that I developed fibrosis of the liver, which is not uncommon for someone who's had their liver as long as I have. And also the medications would take a toll on the kidney. So I was seeing a nephrologist, a kidney specialist, and they told me probably by now I might be on dialysis. But unfortunately, in 2024. I got sepsis and lost my kidney, and so I've been on dialysis now for 2 years, actually, just on March 17th.
You're one of those people that get to, and I say get to because it seems to me to be kind of a privilege. You get to have dialysis at home.
Oh, you can say get to. It's a privilege. Yeah, and that's thanks to my awesome husband, Al, who I've been married to for like 36 years, and I've been with him since probably 46 years. We were originally in Barrie and then traveled back and forth like 3 days a week, Tuesdays, Thursdays, and Saturdays. And then I got transferred up to Aurelia because, I like to have the weekends available. And I was there Monday, Wednesdays, and Fridays. But unfortunately, that the Aurelia hospital is great, and so is the kidney team and that, but they don't let the caregiver come in. So Al had found himself driving back and forth, and it just became way too much. So we were, we looked into the training that goes into doing hemodialysis at home, which we finished, and it was about an 8-week course. It was pretty intense. We went, met with our nurse, Shelley, who's amazing, and we had our own room with the machine and everything, and we got trained, about 8 weeks, and started doing home dialysis July of 2024. So, I'm very fortunate, and one of the other things about doing it at home is I get dialysis more often, which is better for the patient. So if you go Monday, let's say you go Monday, Wednesday, Friday, you're not going back until Monday because the center's closed. Well, it's not closed on Saturday, but it's closed on Sunday. Where at home, I do it every other day. So I'm getting in more dialysis, which is better for my quality of life. And I recently they wanted me to try nighttime, but, I'm a catheter pretty sensitive. So we've increased the hours to 5 hours at a time. So that's also beneficial. That's also better for the patient.
Wow. So tell me about dialysis. It's not just a matter of hooking your arm up to a machine, is it, and sitting there for five hours?
No. So there's three types of dialysis. So hemodialysis, which is the one, and that's where you can have it in your breast, like on your arm, which our friend Jason has. Or what I had, because mine was an emergency, I had a catheter put in, so it's sort of like a port that has these two access valve, I guess is the best way to describe it. And the other one is through your periodontal. I can never say this one. Through your periodontal, through the lining of your stomach, which I can't do because I've also dealt with Crohn's for 30 years and have a permanent ileostomy. But what dialysis does, it hooks you up, but what it's doing is it's taking your blood out, and it's going through a filtration process, and that filtration process will do what your kidney can't do for you, and that is to remove toxins, and also to remove fluid buildup. In my case, I lost the ability to urinate over a year ago, so whatever fluids I take in, I don't get rid of them. So you gain fluids, and any fluid that you have is hard on your heart, hard on your, if you get built up in your lungs. Some people get edema in their legs. So again, that's another advantage of doing it longer and more often. And then, and so that's what it's doing. It's basically, whoever created it is like 60 years ago. And obviously they've come a long way. It's basically an artificial kidney. It's doing what your kidney can't do for you. And what it's doing, it's giving people you can't live without a functioning kidney, right? Without functioning kidneys. So it gives people an opportunity to wait, hopefully, if they can get a transplant. Unfortunately, the transplant list for a deceased donor is long. On average, some patients can wait up to 8 to 10 years. So it's really recommended to try to find a living donor, which sounds like you'll just go find it. It's not easy. A lot of times people's family don't match, and then they find themselves doing the campaign. So, but it is improving in my case, my quality of life.
Well, that's good to hear. But still, dialysis it saves a life, but it's no way to live. And it's...
No, you're tied to a machine.
And in terms of organ donation, it is wonderful because it gives people years and years and years of life. But as we see with you and with Jason, it's not a cure. It's not a cure. No. It's a way to give people more time. But we still need to do more research on artificial kidneys and things that will allow you to be away from the machine and living your life the way you want to be able to live your life. And part of that for you will be a transplant eventually, and hopefully you'll be able to get your dual transplant, the liver and kidney. Have they given you any indication of when that might be?
Originally 9 to 12 months, but it's been 18. Unfortunately, it's not something that's easily predictable because I'm waiting for a deceased donor. And it's the Toronto hospital that I do. They have done over 200 some plus liver transplants. There's no available data on how many combined organ liver kidneys they've done, but it's a question I have from my team. So unlike my first donor, who I'll be forever grateful, and their family for honoring their wishes, this donor would have to have be able to donate a liver and kidney that matches my blood type, my body size, and are good quality organs because I'm not old, but I'm 61 years old, and there's no team that wants to go ahead and do a transplant without knowing that it's going to be successful, right?
Yeah.
So it's hard to predict, and I'm in a different position now than I was 29 years ago. there was 80 people on the list waiting for a liver transplant in Toronto. There's probably over 400, close to 500 right now.
Oh, my.
So that's why talking about living donation, and I have the privilege of knowing people who have anonymously donated part of their liver or a kidney, or have donated both those organs to loved ones. And, you know, the kindness of anyone who's willing to do a non-selective surgery to save someone's life is absolutely amazing. And so are all deceased donors as well, who register to be donors, and again, their family honored their wishes.
Yeah, it's the most amazing gift that you can give someone. So tell us, after you had your first transplant, well, your only transplant because you're waiting for another one, but when you've had your liver transplant, what happened with your life after that?
Drastically changed. There's a thing that's said about people who have received transplants is that they're looking for a way to give thanks. And back then, there was no living donor program at Toronto General. It started a couple of years later. You said, no, so this angel who saved your life, right? And everything's done anonymously. So you write a letter, and, you know, I was fortunate. I wrote a letter right away, or maybe it was 3 months later. I can't remember. No, I think I wrote a letter right away, and I got a response back from my donor family within 3 months. And I received a card from her husband twice so far since my letters. I've been writing for a long time, but the point I'm trying to make is that people are looking for a way to give thanks. And what they do, many thousands, you know, I would say probably 80% of the people, want to bring awareness to organ and tissue donations so that others that they meet as part of the process or along the way can also benefit from it. Or they try to give back in another way, volunteer in their community. You know, so I did that. I was waiting to see my, before I had my transplant, I was waiting to see my hepatologist. And I'd read about the Canadian Transplant Games Association, which is now known as Canadian Transplant Association. They removed the games because it's more than just the games. And I was reading about a team that was getting ready to go to Sydney, Australia to participate in the World Games. So I thought, wow, that was pretty amazing. And there's also a poster that was in the hospital of a liver recipient who I now know and have had the pleasure of knowing for almost 30 years. Heather Fisher, who received her liver transplant in April of 1983, and she was an OR nurse and down in London Health Science Center, and it had her, like, you know, I climbed Mount Kilimanjaro, and she was part of this brochure as well. So I connected with the local provincial director at the time. It was Linda Rowe, three-time Canadian recipient here in Huntsville, who's unfortunately since passed away. And I became part of the Canadian Transplant Association. And with that, I attended my first transplant games out in BC. They were the British or the Western Provinces Transplant Games. And then I attended my first World Games in 1999 in Hungary, Budapest, Hungary. And I've been able to attend 7 World Games. The following year, in 2000, I attended my first Canadian Transplant Games in Sherbrooke, Quebec. And ironically, they're coming back this summer in 2026. And I would love to be able to have had my transplants and be able to attend those games, but we'll see what happens. And I'm the only Canadian that's ever attended all 10 games to date. So I really want to be there in person. And I've also attended 6 American transplant games. So
wow. Well, I hope you get to go. I hope
that
you
in
get to
itself,
go.
yeah, that in itself is huge. I spent a lot of my RSP funds doing that because, you know, you're not sure how long you're going to live and you're sort of doing your bucket list while you can. But yeah, so through that, I have met such amazing people all across the world. And what that has done for me is given me a community of support that has really helped me get through the last 2 or 4 plus years of my life, and to the point where I've had people who follow me on Facebook comment to me like, "Wow, you have so much support. You're so lucky." And I am very fortunate, but I networked and met a lot of people. Let's just say that.
Well, that sounds amazing, and I'm so glad that you have that on the horizon, that you have that to look forward to.
Yes, and then I'll just add that I also got involved with Trillium Gifts of Life Network, which at the time was a multi-organ exchange, retrieval and exchange program. Changed names a few times, and I was fortunate to receive an award from them. And then I got involved in research, and I've been very happy to be involved in research for over 15 years with the Canadian Transplant Research Program out of Alberta. And actually 11 years I've been part of research for 15 years. And actually it's through there that I got reconnected back to UHN when some tests didn't seem normal. And it's also through there that I wanted to go back to one of the things that you said. The amazing people that are working in transplant and donation are truly amazing, and they do have that artificial kidney. There's been some more movement with xenotransplantation, which is the use of animal organs. It's not ideal, but and then developing using cells, kidneys and livers and stuff like that, and it's all because of these amazing people who have been working on research. And the other thing is that I'm really interested in is precision medicine. So getting more precise to like how much anti-rejection medications we take. And this goes back to the point you made that transplant's not a cure. Every transplant recipient goes on some kind of anti-rejection medication. And they make it basically, they suppress your immune system so you don't reject your organ. But by suppressing your immune system, it also makes it very difficult to fight off viruses like, COVID, was really scary for all of us. And many people unfortunately lost their lives to that in the transplant community. Any kind of virus, could lead to death as well. And many develop cancers and stuff like that. So the precision medicine is very, something I'm very interested in.
Mm-hmm. Well, it seems like you're always doing something. Every time I talk to you, there's always something new and something on the go. And I admire that about you and many of the transplant people that I have come across, transplant recipients. They seem to have the greatest outlook on life and live life to the fullest every minute. And I know that every time I attend a funeral, which, is no fun, I will say, but I always hear people saying, this just shows that we have to live every day and we have to really put all of our efforts into making the most of this life that we have. And then 2 weeks later, they're back to the same routine, watching TV every night, not really helping out in the community, but talking about it a lot. And, go back to the mundane day old, same old. And I think that every single person I've met from the transplant recipients organizations, they're just go-getters. They're out doing
awesome.
So many things. And I love the community around organ donation. It's just a fantastic, supportive, loving community. I can't say enough good things about them.
Well, what I say about them is it's an amazing community to be involved with. It's high price of admission, unfortunately. But because we face death and because we know how precious life is, we try to live for the moment. And we've been through a lot of pretty heavy duty stuff. I've been through some stuff, but I know people have been through a lot more than I have, and people are having challenges. And so we try to not focus on those mundane or those minor things that can be inconvenience, like traffic or having a bad air day. I mean, yeah, does it bother us? But like, you know, try not to get worked up. I mean, there's an expression like, you know, you don't like the traffic on a long weekend. We'll try waiting for a life-saving organ transplant, right? Like,
yeah.
You know, so, but it's just like someone like, you know, someone asks me and talks to me a lot, like people like, oh, you're so resilient. So my comment back is like, you know, it's easy to be resilient when you have no other choice. But
exactly.
I do have a choice. I could feel sorry for myself and lie in bed and, you know, not do anything, not give back. But it's just not the person who I am. I mean, my father was my mentor. He volunteered in the community. He did so much. And it just feels good to give back. And it's also too, like, you know, people say, oh, you do so much, but right now it's keeping me going. Like if I didn't have a focus, I mean, I found a balance in my life. Don't get me wrong. Cause like, you know, I'm also going to talk about the other amazing things that have happened over the last 29 years. But it's more emotional to talk about. It's my family, like being able to have my dad till he was 85 and a wonderful mother and father-in-law and my mom's still alive. And I've been able to watch my nieces and nephews and godchildren grow up. And, you know, my niece and my nephew are now parents. You know, I have 3 little nephews and three great nephews, great niece. My godchildren, between the 3 of them, have like, you know, 4 kids. You know, these are precious moments, and like the experiences I've had outside of like triathlon games, like just attending weddings, like, you know, attending celebrations. And I say to my husband, like, things only happen. There are some things that only happen once. You know, there's some things like, you know, you didn't get to go out for a movie with your friends, or you missed a girls' night out, or, you know, you couldn't attend an event that you really wanted to attend. But something most recently that was really important to me was attending my niece's 1-year-old's baptism, and that was March 22nd. And I was there, and like, I'm like so grateful I was able to be there, that I had a good day. The weather was good. You know, because like I said to Al, like that only happens once in life. She's never going to get baptized again, right?
Yeah.
You know, and to be there to witness my niece, who's now grown up to be a beautiful young mother and intelligent woman. You know, and then, you know, be able to watch my great nephews play sports and get on FaceTime with them. Those are precious moments that I wouldn't have had, right? And not even to mention the friends I've met along the way, right? I mean, I consider you a friend. Like, I would never be able to have a platform to get the message out to share, right? And yeah, and so like those are the precious moments, right? And amazing too, like there's people who have had transplant females that have gone on to have babies of their own.
Yep.
Right? Like that, and now grandparents, like that just shows the true gift of organ and tissue donation is that it extends life. You know, it's not a perfect system, you know, that it comes with the complications, but you know, I've still had 29 years. I don't look back and go like, what were the bad things that happened in those 29 years? I look back and say, thank God I had those 29 years, and thank my donor, and, you know, just be so forever grateful for that, you know? So, and even thankful that, you know, I'm on a list, right? Like, you know, like they didn't have to accept me. They could say, well, you know, that's too complicated. Like, you know, so like, you know, and yeah, so.
Yeah, well, I'm very glad that you're on the list. Not that you had to go back on the list, but that you got accepted to the list, because you and I, with our experience through our mutual friend Jason, we know how hard it is to get on that list. You have to be well enough to have the surgery, so you have to be well enough to get on the list, but you're not well because you need to be on the list. What a hamster wheel.
Yeah,
I mean,
and that's the balance I'm at now. Like, you know, when I went on the list, like, you know, I hadn't lost my kidney. I know I did lose my kidney because I knew about my liver fibrosis, but I didn't need to be on a list for that yet. But I've noticed, like, in the last 2 months that, like, when I take my walk, I've been using a walker now for 2 years. When I take my walker and I go for a walk, I used to feel rejuvenated from that and energized. Now it's like my arms are sore, my legs are sore. I'm asking Al, where's the car? Like, how much further do I have to go? Because I have cataracts right now too, and I can't see very good. And I can't get that fixed until after my transplant because there's a high risk of infection and bleeding. So like sometimes, you're on the sun or like you just can't see things very good, right? So I'm like, how far are we from the car? Like, I know the route, right? I'm grateful for my walker. Like without that walker, I would not have been able to do a lot of things, right? So,
yeah.
But I just noticed from when I first used the walker and like how much, I could go faster, I could walk faster. And I've really put a big emphasis, like prior to finding out I have, after I found out I had fibrosis, I made I've always had difficulties with my weight and I was on high dose of cortisone. No excuses, but it's like, I intentionally lost 70 pounds, but then I gained it with the fluid retention, lost it, and I've been continuing to watch what I eat and make sure that daily walks and strengthening are part of my daily routine because I remember the 2 surgeries I had. I remember my first transplant. I remember my ileostomy surgery. I remember surviving sepsis and what that put my body through. And I was hospitalized recently in February because I had an infection in my catheter. And, my education and my awareness got us down to the hospital, like only that I felt sore and a bit of red rash. So we got on top of it because I could have spread and got sepsis. And, people die from sepsis, right? So,
yep.
And, I with my husband, I said, really? It's only a little red rash. It doesn't look too bad. And he's like, nope, we're going to the hospital, right? Like, no one wants to go to the ER, trust me. Like, you're going to be there. And I ended up being in the hospital 5 days. But, and nobody loves going. Nobody. Doesn't matter if you had a transplant or not. Nobody wants to go to the ER if they don't have to, right?
Yep, that's true. Well, we have to take our first little break here on Fresh Waves. This morning we're talking with Sandra Holdsworth. She is a liver recipient who is back on the list, waiting for a liver and this time a kidney too. We'll hear more from Sandra right after this, so stay tuned. We're back on Fresh Waves. I'm your host, Bren Masson. Today we're speaking with Sandra Holdsworth. She is a liver recipient who is back on the list looking for a liver and this time a kidney. A double donor, as they say. And Sandra, you've had quite the journey, let me tell you.
I sure have, Brenda. I sure have.
Now, what's on the roster lately? I know that you've been doing a lot of new things. I know that you're maintaining. I mean, you can't really go anywhere when you're on dialysis the way you are.
No, I definitely can't travel. I've stopped. I did go down to Toronto in January and I spoke at the Privacy Day event, which was a great opportunity. That was part of my role as a patient partner in healthcare and research. But I don't see myself doing those anymore. Like, I'm just attending online a conference that's happening in Ottawa. Would I love to be there in person? Yeah, but I don't have the bandwidth, nor I don't want to be away from getting a call, right? So I want to go to stay local. But I do get out. Like, we did a flag raising actually in Bracebridge yesterday. And I will be speaking Thursday morning, to the District of Muskoka's Health Committee, with support from, my husband, who will drive me there. And then I have, supporters that will be there and I have people lined up just in case I can't do it. But it's important because I'm very proud of Muskoka and, I did plaques up, for all of the mayors here on behalf of Muskoka Gift of Life. association, which I founded when I moved here in 2010. And I've connected with some amazing people, like kidney recipient, living donors, donor families, people on dialysis, people who have had multiple different types of transplants. But Bracebridge is ranked at number one with 59% of people who are registered voters. And my town here is 53, and the main town that people would know is Huntsville, 52. But everything around here is like 50%, including Perry Sound.
Wow.
So it's something to be proud of. So I gave those mayors the plaques, and the district chair, Jeff Lehman, who I actually know from, who was a mayor in Barrie, because I did flag raisins with him there, with Sherry Logan, whose daughter received a liver transplant. And oh my God, like I watched that girl grow up, because she's now in university, and she's now participating on some webinars we're doing on resilience following solid organ transplant. So she got to share her story. So it's pretty cool to be on moderating a webinar that she was speaking at. And as I said, I find balance. But I'm a member of the Minister of Health Patient Family Advisory Committee, so we get to give input directly to the health minister through their staff. Some of the ideas that they have, and more from a patient caregiver lens. I'm actively involved in Patient Advisors Network, which is a national organization of patient and caregiver partners that are really trying to push for change. Like today, this morning, it's all about the fragmentation of our health data records and how patients don't have access to our records. But the sad thing is our providers don't have access to our records. I won't say what hospital it was in, but I was in the ER and I was a patient at that hospital, and they couldn't connect to the system to get my information in the same hospital. I have lots of specialists. Everything goes back to my primary care provider, who is, as we all know, they're all burning out. There's a pressure to get everyone in Ontario a primary care doctor. So those are the kind of things that I advocate for. But I take the lead. I'm an active member of my healthcare team. And I make sure that I'm not going to be falling through the cracks, like the story I told you about with Greg's Price and Greg's Wings. And I highly recommend people out there, if you haven't had an opportunity to see a screening, you can go to Greg's Wings website and look for when they're doing a screening. So they showed the film, and it's very hard to watch because this young man passed away. Because of the system, unreceived faxes, records, referrals that weren't received because doctors were on holidays, tests postponed, all those kind of things. So I'm passionate about that, and as long as I have a voice and I have the platforms, which I'm fortunate, I will continue to do that. But I also find time to sleep and relax and spend time with family and friends, and, get out for a walk and enjoy the sunshine, which has been coming out a little bit more lately, which is nice.
Yeah, that's very nice. I hope you can get into Muskoka, because I heard the flooding is pretty bad in a lot of places up there.
Bad. Yeah, quite a few people couldn't attend yesterday, because, including the chair of the district council, because, it's flooding. But I got the falls like green all this week, so if anyone's up in Muskoka, Bracebridge Falls, they're all like green, so hopefully you can see them through that pouring water. But and even down at the Muskoka Wharf here in Gravenhurst, where we live, and Gull Lake, it's the flooding, and it's a concern. Like actually, you talk about like dialysis concern. Like if the flooding gets too bad and it affects the water, then I would have to go back to the center. I wouldn't be able to do my dialysis at home.
Yeah, there's a lot of things around natural disasters and rescue measures that people don't take into consideration. Like if there's an extended power failure, that could be fatal for you.
Did I tell you that story? I guess not, because that happened last December.
Oh, no.
So everyone knows that Ravenhurst got hit with like a huge amount of snow over a period of one day, 5 feet, almost close to 6 feet.
Yes, I remember.
Yeah, so that basically shut our highways down for like 4 or 5 days. And everyone was brought in. Everyone was doing what they could. But what happened is it also caused the power to go out. And when the power goes out, you can't use your dialysis. Now, we have a generator. Of course, I live in Muskoka, I have a generator. But we didn't know or think that our generator would be able to run our dialysis machine. And in hindsight, it might have if we didn't use anything else, but it would have been risky. We do now have a very expensive generator that can run my dialysis when hydro goes out and can run our whole house. But I found myself in a situation where I was going into day 3 of not having dialysis, which is a high risk because my potassium is really high, and when your potassium is really high, you're at a high risk of heart attack. So I couldn't get anywhere. I know the mayor here and talked to her, and I also have a friend who's on council who was away but was helping me navigate how to get around this. And I called 911. Ironically, the EMS team was on my street, but they had just pulled their ambulance out of a ditch, and they were not going to come back. They were out on the main road. So this ambulance guy walked to my door, and Al and I and him walked 3 feet up in snowbanks to his truck that took me out to the main road, who found back way somehow because all of Highway 11 was closed. And there was no way I was going right to Bracebridge. So, like, I mean, they take you right to Bracebridge, right? Mm-hmm. And but you couldn't get to Aurelia. Let's just say that you couldn't go, but there was back roads to get me to the hospital there. So the ER team did an amazing job, like, bringing my potassium down as best as they could. But I was still high risk. So the next day, the roads are still closed, the hydro's out. And I ended up getting an orange helicopter, which I'm so grateful for. Thank God I didn't have to pay for it. Thanks to our government. So people didn't knock our government down. My dialysis is paid for, and so was that helicopter. Which took me down to the OPP station in Aurelia, where I got another ambulance, and then I was quickly brought to my dialysis team, where I received dialysis and then spent the night in ICU. And then fortunately the next day the roads were open, the hydro was back on, and I was able to go home and do another treatment of dialysis. So yeah, so like you don't know what's going to happen, right? So natural disasters can be really hard for people. And, I always worry about that with my anti-rejection medications and my ostomy supplies. These are 2 major things in my life that I don't want to run out of. People worry about food and drink. Well, that's important. Those medications, they keep us going. You don't want to be off them for too long. And, you need your supplies when you have a permanent ileostomy like I do.
Wow. What an adventure. It just always warms my heart to hear stories where a community pools together to help out. And I think, that guy walking all the way back and coming to get you, and then you and Al going out. Oh man, what a story.
And poor Al, because he was in such a hurry, he rushed out the door. And the guy had the EMS guy had a flashlight, but Al didn't. So he had to walk back in the dark. And we laugh about it now, but he was like, "Oh my God, I'm going to follow my eyes. Let's get out." But it's like, it just shows the kind of person caregivers are as well. Like, his goal was to just get me up and get me into that ambulance and get me to the hospital as soon as possible, right?
Yep.
And I wouldn't know what I would do without him. I wouldn't be able to do dialysis home because he's the one who, the plumbing and the water system and the electrical system to do dialysis at home is not easy. Like he takes care of all that, right? So
yeah, you have to have a separate system, don't you, to handle the waste and things, because it can't go through the regular plumbing.
Yeah. It's there's a whole plumbing and electricity, and downstairs there's 4 big canisters and stuff like. I didn't get trained on that because, it's above my, it's above my knowledge. Let's just say that.
Your pay grade.
Above my pay grade. Yeah. My husband who's, worked in electricity most of his life and is one of those guys that basically can do anything. But, we had a professional plumber and a professional electrical person here. But we've actually, Alan and I have been asked to speak at our hospital about our experience because we're considered pretty amazing team. That we sort of got our stuff together and we're on top of everything. And we've helped improve the program by pointing out different things to them. So I don't think Al's too excited about it. So he goes, I thought it was just going to be a round circle, people talking. I go, no, we're presenting. I said, don't worry, I got you covered. I said, but I'll cover your part. But you can sit and ask the questions about, what you do, right? Because I couldn't do it without you, right? But yeah, I'm the talker of the house.
Yeah. Well, it's good to have one talker and one who's not. If you're both talkers, it gets a little crazy at times.
Yeah, I could try. Exactly. I've seen that.
So you had your transplant and then you did all these wonderful things with your life. And now going forward, what do you hope to do in the near future? I mean, obviously you hope that you get your liver and kidney transplant, and should that all go well, what's next for Sandra Holdsworth?
So, I want to get my transplant. I want to recover. I want to enjoy the summer. And then Alan and I have 2 bucket list items. One is to get a trailer and travel out west. He's never been there. I have, but just to see all of the out west, which is beautiful. I've had the pleasure of being to Edmonton, Calgary, Banff, Vancouver, but I've seen every province, but I've never seen Saskatchewan or Manitoba. I've flown over them. And then another trip would be back to the East Coast where my dad's from. And we just love it. And it reminds Al of where he's from, which is Wales. He was born in Cardiff, Wales, and immigrated when he's just a young little boy. Those are on my bucket list. I want to spend more time going to visit my mom because I can't see her as much. Unfortunately, she's developing dementia and she's in a retirement home with assisted living. I want to watch my great nephews play baseball and soccer this summer, and see them all grow. Hopefully see them graduate from school. I'm not sure, get married because I'd probably be in my 80s for some of them. And I will still continue my work as long as I can with a cutoff date in mind, because I know people are still trying to do this at late 70s, and it takes a toll on you. Every time you tell. I don't have necessarily storytelling, but when you share lived experience, or tell why, when you listen to the stories or lived experience, it takes a toll on you. And when you have to draw on your experience to make a point on why healthcare needs to change, and patients and caregivers' voices and the public need to be at the table when decisions are being made for us. Unfortunately, our healthcare system was built by people that were not they do say everyone's a patient, but technically there's people that are more patients than others. But there's no system or any program that's ever been developed which hasn't been tested on an end user, right? And our healthcare, unfortunately, we're now at the point where now more voices are, but there's still people in healthcare that don't understand why the patient or caregiver voice needs to be at the table. And I want to make that very clear, so that going forward, that any decision, any digital tool, and especially with the huge movement with AI, that we don't move forward with these things unless there's accountability, trust, where is our data being stored, who has access to it. So I will continue that work. But I want to enjoy life. Al turned 65 last year, and, he's ready to retire. Like, he's been retired for a while, but, we look into moving eventually and getting a condo. So we have a nice big property here, but, it's beautiful, but it's a lot of work for him.
Mm-hmm.
Yeah. And, around COVID time and after, you used to see all these signs up and before, like, we will not tolerate anything. And even my doctor's office, the first thing it says, we will not tolerate any abuse and stuff like that. And I love what my EMT doctor's office is, and really it has, my attitude will be based on your attitude. But I started like, why do we need that? But then I started seeing like how healthcare people are being treated. And I'm like, you got to be kidding me. Yeah. So I would be that patient telling the person to like shut up and be grateful. And I'm also the patient that is kind to every single person that I encounter with. And I've had the most greatest conversations with people who have come in to clean my room and just learned so much. And, and nurses and stuff. I mean, they're busier, but they don't have as much time. But, I thank for everything. Thanks for that. And, the people that bring your meals, thank you so much. I appreciate this, right? Because, a cousin of mine who's a little bit older than me said you get more with honey than you do with vinegar.
Absolutely.
But But you also have to advocate for yourself. Like, it's sad when you see people in the ER or in the hospital when they don't have a care provider with them.
Yeah.
And that really breaks my heart when, when my dad was hospitalized on his 85th birthday, like, my whole family was there. My mom, me and my two brothers and my niece and my husband. And the doctor says, wow, I've never seen so much support for one individual. This guy must be pretty important. And we're like, yeah, he is. Like, don't, but there's people that don't have any.
I mean, there's so many opportunities for volunteerism within our hospitals and within the different organizations around health. And I love the way that so many of the organ recipients that I've encountered are those people. They volunteer at the hospital. They volunteer at organizations. They do what you do and go and speak at organizations and present and make their views known and bring forth little issues that seem like nothing to, the average person getting onto the TTC in the morning, but to organ recipients, they're huge issues. And, it's nice that people who, have received the gift of life can give back to the community around them.
Yeah. If you haven't already had a chance, if you're familiar with the Transplant Ambassador Program, my friend Sue McKenzie, who's a kidney recipient, started that. And a lot of my friends do it. And what they do is they go to where people are having dialysis and they talk to them about their experiences being a living kidney donor or just getting them. It's like, I've been involved in research lately. You know that there's obviously an EDI situation, equity, diversity and inclusion in organ transplant. But there's so many people that don't even get referred to transplant that are on dialysis for years and nobody's ever said, hey, did you know that, transplant could get you off dialysis and it's the number one treatment right now. And so Sue McKenzie's working on that. So she might, if you haven't already, I'll send you her information.
Yeah, I would love to talk to her.
Transplant Ambassador Program. And they're doing great work to, advocate to our government the importance of like people being able to, awareness about chronic kidney disease and, to begin with, like what causes chronic kidney disease, access to tests to find early detection. So you're not like finding out you have kidney disease and then going on dialysis, like that shouldn't be happening. But then also being aware that, people find out about dialysis, but not everyone finds out about transplant.
Yeah. Well, yeah. And
so that's why I said I'm so grateful that I'm on the list because there's people out there that probably are not getting that.
Again, it goes back to we were talking about advocacy, about advocating for yourself and getting information. So if people want more information about organ donation, how would they go about getting more information?
The best one in Ontario is beadonor.ca, which is the Children Gift of Life website. You can also go to Canadian Blood Services to find out more. The TAP program, Transplant Ambassador Program. And if you want to get involved in research, the Canadian Donation Transplant Research Program. We call them patient, family, and donor. So you can be a patient, you can be a family member, you can be a member of a donor family or a living donor. And we're looking for people, there's always opportunities for people to get involved.
Perfect.
Or the transplant hospital you're close to. So, UHN is a big one, London Health Science Center. You'll find that at beadonor.ca where the transplant hospitals are.
Great. Well, and
ask your doctors.
Yes.
They should know.
Yeah, and it's so simple. Go to beadonor.ca and make sure that you've registered to be a donor. I remember that I was doing these shows for 3 years, and Jason was talking to me about going to beadonor.ca, and I said to him after the show, off air, I don't need to. I already signed my donor card. And he said, didn't we just say that? Yeah. It's not good enough. You've got to go and register. And when I went to register, I realized, yes, I had signed my card 30 years ago, but I had not registered. And I'm lucky.
And many of Ontarians
don't know that. And you know what? Yeah, I'm lucky because my family knows my wishes. They know darn well that I am 100% for organ donation. And I even said to my mother, she's passed away a couple of years ago, but before that, she was 91, and I'm talking to her about organ donation, and she said, don't you talk to me about that. I'm too old to donate anything. And I said, your skin's beautiful. Who knows? Maybe they could use it. Just leave it up to the medical professionals to determine what they can and cannot use. Don't you, as a layperson, say, nah, they wouldn't want this and they wouldn't want that, and, my eyes are the wrong color and my hair's all frizzy and my skin's not great. That's not for you to decide. Let the medical professionals decide that.
I was actually asked that yesterday, and someone said, I got a signed donor card, and then I do my driver's license. So I went, a donor card that's crumpled up in your wallet? No. But if you got a form through Children Gift of Life with your health card or your driver's license, yes, but still check the back of your health card to see that you're a donor, or you can check on the registry beadonor.ca. But some of those statistics, and especially in York region, and especially my hometown, I'm not too impressed with their donor registration rates. They're actually below the provincial average, York region. So I might be contacting some of the mayors from that area and saying, what's up? Because, and even in Toronto, we brought the games there in 2016 and we helped increase donor registration, but they're still only 24, 25%. Too low.
It is too low. And it's unfortunate that it takes an accident like Humboldt that spurs the Logan Boulet effect, and all these people signed on. But since then, those numbers too have dwindled. It was a big insurgence of people signing, which is fantastic. But we need that all the time. We have a ton of new Canadians. There needs to be a ton of new education and information and places available. Yeah. I think it's just wonderful when people actually see you guys, the people who are organ recipients.
Living proof,
And then they look at you and say, wow, isn't that great?
You learned a lot all these years, Brenda. You could do your own PSA and cover all the facts there. Yeah. It's important. Yeah. So we say decide what you want to do, register, tell your family, and live your best life. Because realistically, there's more chance that you will be on the list than being a donor.
A donor,
There's more, because it's, So, and that's all we want people to do. And as the Boulay said, have the kitchen table talk. And it all comes down to education. And Toby and Bernadine, actually, they helped Canadian Blood Services come up with Orgamites, which is an educational, really cute little organs that came out of the UK, but it's been implemented for Canada. It's education that's done through the grade school program.
Oh, nice.
And Dr. Bill Wall, out of London Health Science Center, that was a surgeon there for years. He wrote a book called The Ant Who Needed a Transplant, which is a way to talk to kids about transplant.
Nice.
And then there's the high school outreach initiative out of UHN, and it's a combination of Children Gifts of Life and other communities. So yeah, we're getting the education out in the school system, and Bernie and Toby being teachers. That's what it's about. It's about the education, and that needs to continue.
Absolutely.
Yeah.
And if anyone's interested in some of the myth busters that we've done over the years, you can go to our YouTube channel, Fresh Waves Radio. Hit subscribe while you're there, because we love to have subscribers. And when you're there, you can see all of the organ donation awareness shows. And one that we did at the beginning of April this year in 2026 is the Mythbusters show. And it addresses a lot of the questions that people have and a lot of the concerns that they have. No, I don't want to be a donor because my husband wants to be able to scatter my ashes and there won't be enough left of me. And that's a total myth. And I've had people say the most incredible things that are, in fact, actual myths. So take a listen to that show. It's really interesting, and it's something that maybe I won't play it just once a year. I should probably play it throughout the year so that we can encourage people to go to beadonor.ca and register to be an organ donor.
Thank you so much for what you do, Brenda. It's amazing to have someone like you. I know you're a great friend of our friend Jay. But it's great that you're doing this and bringing awareness and using your platform to do this.
Well, you know what? I'm just so happy
people.
that I can help in any way. And if this is the way that I can contribute, then I'm happy to do it. I wish you all the best. I hope that next year when we speak to you, I'll be speaking to you before next year. But when we do the show next year, I look forward to you being the new recipient of a liver and a kidney.
Yeah, you and me both.
Yeah. Well, take care.
Thanks, Brenda.
Thanks again for joining us. Well, that's it for Fresh Waves this week. Thanks for tuning in. We hope everyone has a wonderful week. Again, go to beadonor.ca and register to be an organ donor. We'll catch you again next week on Fresh Waves.